Hi, everybody. I'm Adrienne. I'm the TA from your women's health class. I wanted to do a quick video to address some of the points that I went over individually with the students yesterday. And it occurred to me that they might be helpful for other people to hear. So in addition to doing virtual office hours with you this week, I wanted to give you a short video addressing some of those points. And hopefully you'll find it to be helpful. If not, you're still welcome to make individual appointments with myself or with Dr. Hamilton to go over your exam grades. But I did find that a lot of the students were having significant difficulty actually approaching the questions. And when I asked people what their method was, they generally said, I read it and then I answer it, and it didn't really seem like people had a strategy in place. So I'm going to introduce you to a strategy that I use whenever I'm answering nursing questions, be they N-CLEX or anything that I need, basically. It's been particularly effective for me, and you may find that it's effective for you. So this is just one idea. I apologize. I'm here at home. This is my kitchen/dining room. And you'll notice that when I write on the board, it'll flip the letters. So instead of using too much actual sentences and topics, what I'm going to be doing is drawing pictures mostly so that it won't matter to you, that you're not going to be able to read them. But anyway, let me know if this is helpful to you. And if it is, then I will post more videos like this. So the first thing you want to do whenever you read a question is that don't be intimidated by it. So questions will often be super, super long, and I'm sure you guys are all familiar with that. And sometimes they're designed to trick you, depending on the class or the test. But sometimes they're trying to give you the necessary information woven into a vignette of this person. So the main things that I always look for before anything else is the chief complaint, right? So the diagnosis, which is going to look like a XD to you, but it's a DX right here. And so somewhere in here is whatever the chief complaint is. Sometimes it's at the very beginning, where they're like, 33-year-old African-American male complaining of epistaxis, right? Chief complaint of epistaxis. So you'll know, and they may tell you everything else about this person. He's in law school, and he's stressed out, and he's recently moved. They'll give you all of this other information. But what you can look for first is this chief complaint, also known as the diagnosis, right? And that may be the critical piece that you need to look at to answer whatever it is the question is asking you. Sometimes the chief complaint won't be enough for you. So the next step that you want to go to is, what is the population? The population is usually included in here somewhere. It can be at the beginning as an identifier, 33-year-old African-American male, or it can tell you a situation and then say, of this elder female, or of this pregnant female. So they'll give you some details about the person. I will tell you that because questions are designed to be as concise as possible, if they give you information about the chief complaint or about the population, it's relevant. So kind of keep that in mind. Now, given these two pieces, you may actually be able to narrow down your choices. If you can't, though, the very next thing you do is you take these two pieces and you look for, is there an algorithm? If an algorithm exists, then this is just a straight up memorization recall question. So they're really expecting you to have studied however it is that you study. You'll be able to remember what you do for this particular person in this particular situation. So sometimes there's an algorithm, and we talked about that yesterday with Dr. Hamilton when we talked about when are you doing colposcopy? When are you doing a wet mount? What are those particular circumstances? What if somebody has HPV, or we're not sure if the person has HPV? How long do we wait until we have them come back, right? Those are set algorithms. So knowing those, having those memorized will help you do the question. But sometimes there is no algorithm, which we saw when we started talking about the sexual abuse or rape survivors, right? So that is kind of an issue. So if all else fails, your next step is to do your differential diagnoses. And I will tell you that it's best to just kind of have in your mind that you should always be able to come up with 5. Always. And I'm sorry, you can't really, I know the camera's not, there we go. So you can kind of see the 5 lined up. The way that I break them down to remind myself how to answer a question, because sometimes we're tempted to go to the most severe example, is that cancer, any sort of cancer, is always number 5. Don't use it for anything else. Because worst case scenario, the person has cancer, right? That's a skull. That's my skull and crossbones. So we're really hoping that the person doesn't have cancer. So before we tell them that, we're going to look at every other option. So now you have 4 left that you get to pick from. The first 2, you want to make them local. The next 2, you want to make them, because you're expanding, you want to make them regional or system. So if you use this system, oops, all right, I'll grab another pen. So if you use this system where you go first from the chief complaint, then to the population. Can you see that? Is that too light? Okay, let me find this marker. Hold on. Okay. It disappeared. I'll grab another black one. Okay, so first to the chief complaint, then to the population, right? Then to the algorithm, if any. There may not be. Then, I think IV is 4. Is that right? I'm such a dork. It may be VI. Sorry. This is supposed to be 4. So the idea is then, if all else fails, then we start looking at differential diagnoses. So mentally, this is how your brain should be breaking down the question. Because if the question is talking about a girl who exhibits petechiae on her cervix, right? Then you've been given all of this information, and now your options are, your options are an STI, potentially, right? Your options are pelvic inflammatory disease. Your other option is dermatitis. And then your other option is cervical cancer, right? When we look at those options, we want to go to whatever is the most local. So if we're talking about her cervix, we're talking about what we observed on the cervix, let's talk about what's going to do that to the cervix, right? So in that case, you're immediately going to be thinking of what STIs or STDs directly impact the cervix, right? So that's your answer. If that doesn't work, for example, there is nothing that's local, then we start talking about regional or system, pelvic inflammatory disease. Okay, because now we're talking about the area, which potentially the cervix is a part of and is related to. That makes more sense, right? Then we would kind of branch out to the next level, and at the very end, our very last option is going to be cervical cancer. So any question that you get, you can really use this mechanism here of starting 1, 2, 3, 4 to break down the answers themselves and say what makes the most sense. Most of the time, you won't ever get to stage 4. Most of the time, you'll be able to work it out just with what you know of the chief complaint. So that actually takes me to the next point. I know I'm moving a little fast. It's good that it's recorded, so feel free to rewind it if you need to. So that takes me to the next piece, which was actually a big part of a lot of the questions that you guys got, which is that questions will often follow the nursing process. I know it's backwards. I'm sorry. There you go. I'm going to try to do it backwards so that it works out for you. Is that? Yay! Add pi. Okay. So anytime you're asked a question and one of the options in the answers is assess something, that's the answer. I mean, I don't know how else to make it more clear. No matter what we do, we're always going to assess first in any circumstance. So anytime somebody says, what would you do? Or the question is, what would you do? How would you respond? What is the NP going to do in this situation? the very first thing is that you're going to perform an assessment. So things like ADPI and also what is another one that's airway, breathing, circulation, right? It seems really simple, but these concepts do reappear in the types of questions that you get. So even though you guys are really at this higher level now and you're thinking more conceptually and you really have access to so much more information, don't forget your nursing basics because they're going to save you with a lot of these questions. Another basic that you have here is Maslow. You guys remember Maslow's hierarchy of needs? And you've got the physio. This is all backwards. Sorry. I'm going to do a little body so that you remember that this is the physio. And then as you progress upward, you've got a happy person at the very top. Midway in here, you've got the brain, where they're able to kind of self-actualize and think and all that sort of thing. Right after physio is, are they safe? Right? So safety is a really, really big piece of a lot of the questions that you had on your exam. This is a stop sign. I don't know if that's the best symbol, but I can't. Oh, maybe a Band-Aid? Okay, here's your Band-Aid. Anyway, this is safety. In nursing practice, safety trumps everything. So in questions where they ask you in a way that's meant to trick your ego integrity, like what is generally true about the best birth control method? And one of the answers is like the ones that are prescribed by the APRN. It's true that makes sense, that the APRN has a holistic approach. But questions like that are meant to work on the upper levels of what you believe, the upper levels of your ego integrity. Safety is way more important than your opinion about your practice, way more important than really anything else other than physiological situation, which goes back to airway, breathing, circulation, right? So keep in mind that there's this pyramid here. So whenever you're approaching a question, if the word assess is in it, that's the answer. If the word safety is in it, that's the answer. The same way that it was the answer in LVN school, honestly, to tell you, because even though you guys are at a much higher level of nursing at this point, these same basic tenets still really hold true. Yeah, but they are throughout the curriculum, so you'll see them again. The last thing that I have for you is how to study. And we talked about this a little bit. So nurses are often exposed to case studies. So you'll get a case study of this patient, patient 1. And patient 1 may have all of these different things going on with them, right? And then you go see them in clinical, and you guys meet. Hi, I'm feeling sick. And you're like, oh, how can I help you? And then you go and you get their medication. I'm sorry, my phone is ringing. Please ignore that. So you get their medication. You get them whatever food. You get them whatever IV fluid that they need. And they feel better. Or they feel really horrible. They throw up or whatever else happens, right? But at the end of the day, you go home and you remember that patient from your clinical experience. And you may remember what they were thinking because they were talking to you about their family. They were talking to you about school. They were talking to you about other issues. They were talking to you about their substance abuse history, maybe their sexual history. They were talking to you about all of these different things about them because they're multifaceted people. They're multifaceted humans. And you're a caring nurse, so you want to know about their holism. That's part of what you care about. So you'll never forget these patients because of the time and investment that you used with your whole brain comprehending this person. This is how you study, because this is how nurses do best. This is how nurses build this clinical experience background in a way that really nobody else does. with this interaction and this understanding of the whole person that you probably won't ever forget, right? So fake it while you're in school. You're not going to have these people face to face. It would be great if your clinical experience always overlapped with whatever you're being tested on in the didactic portion. That doesn't always happen. So create imaginary standardized patients. And you can make them, because they're not real, because they don't exist as humans, you can make them whatever you want them to be. Whatever it is that's going to help you remember them. So here you've got these two gals. And your purpose right now is that you want to figure out what is the best birth control for gal number 1 versus gal number 2. So imagine two girls walk into your office. You're an NP. Give them whatever situation you want to give them, right? Call one, this is going to be really bad. I'm sorry, I can't really think on the spot. Let's call this one Dating Darla, right? DD. And what we know about Dating Darla is that she has had multiple pregnancies. Maybe she's had multiple abortions. Maybe she doesn't want to get pregnant again, but we know that she's sexually active. Maybe she has used emergency contraception a number of times. Give her whatever backstory that you want so that she exemplifies whatever it is that you need to study. Then this one, let's call her young Yanni, maybe? Sure. Whatever names work for you, right? But something that makes you remember them. And this girl has never had sexual intercourse, and you can make it as elaborate as you want, has never had sexual intercourse with a male, maybe. Maybe she's only had intercourse with females. Maybe she doesn't want to get pregnant ever, and she also doesn't like having her period. So she really wants to not even bleed if she doesn't have to. Make these stories however intricate you want to make them, and then write them a prescription. Pretend that you talk to them, write them a prescription. So whatever section that you're studying, instead of having a big, huge, long study guide of all of these different notes, things that you're trying to keep track of, just make them people. Make them somebody that you are going to remember. Make their names memorable and connectable. And don't do it all yourself. So you can take a chapter or take a topic, divide it up with friends, and say everybody has to bring 2 case studies for their part of the chapter. And then present your case studies like you're doing rounds. Maybe that'll help. Draw it out. Give people flyers or little handouts that are Xeroxed of your patients. Do whatever you want to do. Act them out. Pretend if that works for you, and it helps stimulate your memory. But this is a lot of information. It's an incredible amount to memorize. So you really want to be able to use mnemonics. You want to be able to use kind of creative ways. I'm a real visual person, so that helps for me. But definitely make these people real to you, and see if that makes any difference with your recall. Again, like I said, try some of the techniques that we talked about when it comes to approaching questions on the sample exam questions that are posted in Moodle. Feel through it and realize, honestly, that everybody that I've met and talked to who's taking the class right now is very bright and very capable, but not necessarily expressing their best self on these exams. And when I read them, I know that you know, but I just want to make sure that you're able to convey all of this great knowledge that you have, that you've accumulated throughout the quarter. So have faith and confidence in yourself. Work on a few of these different techniques. And if you have any questions, feel free to bother me. Of course, I'm happy to talk to you guys. Or of course, Dr. Hamilton, try to make an appointment with her because she's a wealth of knowledge. So that's about it for this. Let me know if these videos are helpful, and I will try to post more of them in the future. And I hope you guys are having a good night. Thanks.